Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about how to treat a bunion on a big toe, and also some of these exercises can relate to arthritis of the big toe as well. But before I continue, please hit the subscribe button below. So in terms of bunions on the big toe, a lot of times these are associated with footwear and rubbing on the outer portion of the big toe as a result of the footwear being really tight. And then what will happen is the big toe will start to move inwards and this bunion will form on the outer portion of it. So the exercises, in a lot of ways, what we want to try and do is bring that big toe into more of a neutral position. And then in a lot of cases, there'll be a lack of extension, so basically putting that big toe upwards, that can affect your walking pattern as a result of how it's positioned. So there's 3 specific exercises I like to do to try to, again, improve the mobility, get the big toe into more of a neutral position, and to basically bias the opposite of the position it tends to go into when we're wearing footwear. So essentially what I'll have the patient do is, the first one is actually a little bit of traction on the big toe. So you can basically grab onto the big toe and do a very gentle pull, not going into pain. So you really want to, and I really want to emphasize the fact that you do not want to go into pain when you do that. And so you want to do a fairly light resistance when you're doing this. And I would try to hold for a good 2 to 3 minutes or so. Then from there, you can actually grab the big toe and go into what's referred to as abduction. So now what you're doing is you're moving the big toe into more of a neutral position. And again, we want to stay clear of pain when you're doing this. So again, we're moving from the toe being really scrunched inwards. We're trying to pull it into more of a neutral position. And then finally, we're going to go into some extension. So extension is basically bringing the toe back, and that's where a lot of people with this condition will be somewhat limited. The other thing I'll have people do is actually try to work around the muscles that will influence that big toe movement beforehand as well. So the plantar fascia or some of the intrinsic muscles around the foot. If you have any specific questions or concerns, feel free to leave a comment below, and have a great day. Take care.